Bill number 26, the Emergency 911 Act. I recognize the honourable member for Halifax Citadel Sable Island.
Mr. Speaker, I am pleased to rise today to speak to our bill number 26, a series of amendments to the Emergency 911 Act that would create a province-wide emergency mental health service. Mental health supports in Nova Scotia are insufficient. Despite the 2021 budget investing $336.5 million into mental health, it represented just 6.3% of total healthcare spending, far below the 10% recommended by the WHO. This actually marked a drop from 6.7% in 2020, showing the investment in mental health care is not keeping pace with overall demand. We need a strengthened mental health system in Nova Scotia across the spectrum of acuity, from mental health promotion to inpatient mandated care. Building a different kind of mental health crisis response in Nova Scotia is a deeply personal endeavour for me. I have previously shared with members our struggle to find mental health services that worked for our family. Without shame, I can re-share with you the dozens of times we needed help to keep our families safe, and the only option was to call 911. This was, in fact, step one on our official mental health crisis plan we had in place with the IWK. Calling 911 to help your child through a mental health crisis is a devastating experience. The fear and chaos that necessitates the call is enough. Then the concern is who will respond and how. In most of our experiences, paramedics would not enter to assess our son without police going in first. So let me just describe it to you. Your child has tried hard to manage through something else that most children can do. A day at school, a doctor's visit, a family walk in Point Pleasant Park. As parents, you have done everything you can to make the day a success, attending to food, water, sleep, comfort, and preparing with social storytelling. Yet your child is now experiencing extreme distress, and the whole family needs help. As we were parents of a small child, the vast majority of Halifax Regional Police officers who responded to us when we called 911 responded in a collaborative manner and wanted to work together to de-escalate the situation. Nonetheless, we relied on their goodwill as decision-making was removed from us and from our son. Calling 911 never resulted in increased or more appropriate services. We often ended up in the IWK ER for hours and then were sent home with nothing new in place. In fact, I would say that for all of us, this repeated experience time and time again increased our overall stress and trauma. For too long, Halifax Regional Police was our mental health service provider, but I know that officers were always concerned about responding appropriately and deeply frustrated with the system that provides services, that doesn't provide services once they were done their role. Aside from the stories I can tell and the stories of so many other families that I've been entrusted with, why should all Nova Scotians care about this initiative? Why should all Nova Scotians care about improved mental health response? Firstly, we obviously want to build a mental health care system where these type of crises are greatly decreased through effective prevention, treatment, and care. Many folks in mental health crisis end up being a cyclical caller because we have such limited mental health care resources in Nova Scotia. We need to break this cycle. Police do not want to be in situations where they have to use force against someone who needs medical treatment. They clearly see the mismatch of need and response. And police presence can often escalate the situation. The knowledge that the police will come first is often a deterrent from seeking help when it is needed. Finally, I would say that increased contact with the police and potentially the justice system because of mental health crises leads directly to the overrepresentation of undiagnosed and untreated mental health issues in carceral populations. What do we have now in Nova Scotia? HRM has a mental health mobile crisis team. And with all due respect to the people and organizations that manage the program, I contest its name. It is not mobile. On a number of occasions, I have tried calling the mobile mental health crisis team. There is often no answer, or someone answers, but no one is available to respond, or someone can talk on the phone, but they can't come to the scene, or because of the level of mental health distress, uniformed police officers have to respond first. You can see why I usually say it's not mobile, it's not a mental health service, and it certainly does not respond in crisis. And I'm so certain of my opinion that if we could use props, I would try calling now so that we could see how the service does or doesn't work. I have only had one positive interaction with the service, where a plainclothes mental health clinician came to our house and de-escalated a situation. That one time literally followed on weeks and months of advocacy by us to have a better response for our family, and it happened once. I also know that my family is privileged and that we live in urban Halifax, about 5 minutes from the IWK ER. While I was in high school in Canning, my mom sought a restraining order against her ex-partner. I remember calling the RCMP detachment in New Minas and the officer being quite frank, "We are 20 minutes away in the best case scenario." So that goes for anyone in rural Nova Scotia who is in crisis. And yes, there are mental health crisis lines, but they're not enough in a mental health crisis. Despite our limited resources as well, demand is increasing. This spring, police in Cape Breton reported a 19.6 increase in 911 calls in 2021 compared to the same period from 2020, with most of the calls related to domestic issues and mental health and addictions, and I've tabled that article. Spring visits for mental health and addictions increased from 191 to 458 in the central zone, and other zones saw similar increases. In our community, mental health wait times remain long. Remember, these are the services that will keep people out of crisis and keep communities safe. Wait times had a brief decrease in 2020, but there has been a rapid climb in wait times in 2021. You can see it for yourself on the Nova Scotia Wait Times website across child, adolescent, and adult mental health services. Wait times are increasing to pre-COVID levels. Health zones have a target of 7 days for urgent mental health care, and more or less, most zones, aside from Eastern Zone, meet this goal for 90% of patients. The only thing is, this isn't the right goal. The Canadian Psychiatric Society and other evidence-based Canadian mental health initiatives stress that urgent mental health needs need to be addressed within 72 hours. So Nova Scotia Health does not have the right target. For non-urgent adult care, with the exception of Yarmouth Regional Clinics, 90% of adults will be seen within a range of 42 to 85 days. And in Yarmouth Regional Clinics, they lead the province with wait times of 20 days for 90% of patients to have their first appointment. For child and adolescent non-urgent care, the average province-wide wait is 75 days for 90% of patients. And I would suggest that 75 days is a long time for a child. It is, conceivably a semester of school where you don't get to go to school. It's a whole sports season. It is quite literally a large percentage of their lifetime. And we don't have clear data from there. For instance, we don't know how long it is, or it's not publicly reported, from the first appointment, which is usually a brief assessment, potentially a quick intervention, but not likely. We don't know how long you wait again. So you get past the first appointment and you wait longer. And we have limited outcome data, so we actually don't even know if what we are doing in terms of mental health services is working. For emergency mental health response, I would actually suggest that there is a solution. The good news is that communities around the world are already working on building alternative crisis response programs for mental health. Since the summer of 2020, I have been part of the International Reach Out Response Network, an international collective of people around the world that is working on alternative models of crisis response at the municipal, provincial, and state levels. Members come from diverse sectors, including mental health clinicians, law enforcement officers, paramedics, community members, and peers. They come from all over the world with a concentration in North America. I may have lost track of all of the initiatives, but current Canadian jurisdictions looking to develop an alternative system include Ottawa, Toronto, Edmonton, and Victoria. The group meets bi-weekly and is collectively developing models, resources, and training to make the idea of rapid, trauma-informed responses that reduce law enforcement encounters and reduces unnecessary emergency use. Our plan is put forth by this bill is to introduce an emergency mental health service in Nova Scotia that provides true crisis intervention. a model consistent with what mental health professionals, community organizations, anti-racist advocates, and police themselves have asked for. Training can be undertaken within the current 911 system to develop the capacity to identify which calls can be responded to by a mental health crisis team. Most of the programs that exist or that are in development have a goal of diverting 75% of mental health 911 calls to a mental health team. Teams can include community paramedics who assess for medical and mental health emergencies. A clinician can attend to the client's mental health needs. A peer specialist with lived experience can help make the connection with clients to gain trust and move them to be more open to care. Proposed services would be community-based. Behavioral health crises are rarely exclude external material factors. So after the response call, there is a need to follow up to connect clients to services such as treatment and housing. We can do so much better in Nova Scotia. Better use of our law enforcement and emergency services, better use of our mental health resources, better mental health. The fact is, Mr. Speaker, Madam Speaker, the existing mental health emergency support services are not good enough, and Nova Scotians deserve more. There are literally lives on the line. If the government agreed, they would vote to pass this bill into law today. Thank you.